My name is Philip Unjum, and I'm presenting a case of neutropenic fever with pancytopenia secondary to suspected methotrexate toxicity in the setting of normal levels. So this is a case of an 83-year-old male. He has a history of rheumatoid arthritis, and he had been on low-dose methotrexate and folic acid daily for 30 years. And as you probably know, methotrexate is an antimetabolite. It inhibits the dihydrofolate reductase enzyme, and that reduces the body's ability for DNA synthesis. And this is useful for conditions such as rheumatoid arthritis. However, there are multiple contraindications, and this includes renal dysfunction, liver disease, and active infectious disease. Another well-known side effect of methotrexate toxicity is pancytopenia and myelosuppression, and this is a dose-limiting side effect. The clearance of methotrexate takes around 2 to 3 days. So this 83-year-old male with a history of RA on methotrexate came in with fever, oral ulcers, pain with swallowing, and easy bruising, and he was also found to be febrile and cachectic. His labs were significant for pancytopenia, and he was started on cefepime at outside hospital due to concern for neutropenic fever. And his ANC was 4, so he was treated empirically with cefepime. However, his methotrexate levels were normal, and he was started on thiamine and folate, as well as discontinuing methotrexate, and he had improvement of his stomatitis and odynophagia. Gradually, his labs did stabilize, cytopenias resolved, and workup for things like tumor lysis, MGUS, viral syndromes such as CMV, Fouty syndrome were all negative, and X-ray, which you can see on the bottom, was also negative for pleural effusion. So ultimately, his cytopenias and his stomatitis resolved in the setting of normal methotrexate levels. So overall, this patient, he did not need leucovorin rescue, and this was normal levels of methotrexate. And this patient ultimately did have toxicity despite having stable dose, renal function, and relatively routine blood checks. So the fact that this patient did get methotrexate levels approximately every 3 months is an indication for potentially more frequent checks. So around 1% of patients on methotrexate ever progress to pancytopenia, and this is rarely documented in low doses over the course of 10 years. However, normally methotrexate CBC intervals should be approximately 2 to 4 weeks for the first 3 months, 8 to 12 weeks for the next 3 to 8 months, and then approximately every 12 weeks afterwards. So in this case, the patient would likely warrant more frequent lab checks of his blood values to make sure that his methotrexate levels, while normal, are not leading to toxicity. Thank you.